Welcome, everyone. Great to see so many trickling in. We're going to get started in just a few seconds. It's always so much fun to see those participants go up. We have a packed agenda, so we're going to go ahead and get started. This is being recorded, and we will share out the findings as well as the recording and all the presentation materials. Our promise to you is always within 7 days, so look for this by the end of next week. My name is Kimberly Krupa, and I lead network engagement and development for the Florida College Access Network. I'm thrilled to be here today with these amazing guests and guest speakers and experts for a really important conversation about emergency aid programs and their potential to keep our Florida students on track to graduation. Before we dive in, just a quick share on how you can engage with us today. You can drop your questions in the webinar dashboard at any time during our conversation, and we'll address them live. We'll also have some time for Q&A at the end, but we appreciate questions as they occur to you, and we'll do our best to address them. You can join the conversation using these handles, and we'll make the recording and materials available as quickly as we can. For those new to FCAN, welcome. Our vision is a Florida working together, where education is the pathway to economic mobility for all. And as we'll hear, recent research shows over 3/4 of Florida students who left college cited financial reasons, making today's discussion particularly timely and crucial. So at FCAN, we work through multiple channels to strengthen Florida's talent pool. Today's discussion is highlighted in yellow of emergency aid programs fits within this framework perfectly. We're examining research, we're sharing successful models, and working together to strengthen student support systems. And convenings like today really go a long way in bringing together leaders for solutions-oriented conversations, which is what we are all about in our movement. Our work is guided by 7 conditions for success, and today's conversation really aligns well with the 2 key conditions highlighted here. Opportunity for everyone. Emergency aid programs are one of those critical supports, and affordability. That post-secondary education needs to be within everyone's financial reach, regardless of household income or life circumstances. So, and that's exactly why these programs are so important. They help ensure that those unexpected financial challenges don't become permanent barriers to completion. So before we hear from our experts, we have kind of an event happening in just over 6 weeks. We want to make sure you know about an opportunity to continue this conversation about emergency aid and many other student success strategies. We wanted to share that the early bird registration is ending on Monday, March 31st. And we will have a dedicated session on emergency aid with some of our guests from HCM strategists on this call today. So we're excited to welcome you to learn more during our May 5th through 7th summit. So now let's hear from our experts about how we can strengthen emergency aid in Florida. So I'm pleased to introduce today's expert panel, which will be moderated by my amazing colleague, Dave Sobush, who's FCAN's Director of Research and Policy. Dave will very soon set the stage with an FCAN research recap on what we call the real cost of college in Florida. And then our speakers will add to the conversation by revealing their research insights, their hands-on experiences, implementing successful emergency aid programs. So from HCM strategists, welcome Will Carroll, Managing Director of Strategic Finance and Student Success, and Brene Smith, Program Associate, who will share their recent research on Florida's emergency aid landscape and opportunities for growth. Hopefully you all had a chance to look through that research, which we did share ahead of time, but don't worry. We'll do a pretty good recap, and you can always read the report at your leisure. We're also fortunate to have 2 leaders from North Carolina's nationally recognized emergency aid initiative on our expert panel. Welcome, Dr. Kelly, President of McDowell Technical Community College, who will share how their Finish Line Grants program evolved from supporting students near completion to helping students throughout their academic journey. and welcome Dr. Reynolds, Associate Vice President of Student Services at North Carolina Community College System, who will discuss how to build and scale effective emergency aid programs across an entire state system. So with that, I am pleased to hand the mic over to Mr. Dave Sobush. Dave, take it away.
Thank you very much, Kim. And while I do have the mic, I don't have the clicker. So Kim, I'll pull on my ear or something like that. So I just wanted to set the stage a little bit and thank you all for being here by making sure that everybody had some of our key takeaways and key recommendations from our recently released research report, The Real Cost of College in Florida. So Kim, if we could go to the next slide. As many of you saw in the report, we talked about the fact that although Florida tuition is low compared to other states, many students continue to accumulate debt. We're all very proud that U.S. News and World Report has ranked Florida #1 in higher education for many years in a row. Unfortunately, that same report has ranked Florida number 26th in terms of the amount of student debt at graduation. So while tuition and fees are low, we know that affordability remains a concern for many of Florida's students. And inflation has continued to ripple through our economy, and this does not leave students untouched. 45% of Florida households struggle with everyday living expenses, according to the most recent United Way ALICE report. And just like those households, many students are struggling to afford those basic necessities of food and housing, which are becoming the major drivers of attending college. Affordability continues, and we'll hear more about this from HCM strategists, to depress college going rates. It's very high on the list of concerns that students have when they contemplate a post-secondary enrollment. A recent national survey said that 65% of students, prospective students, refer to cost as an important factor. 43% said cost is the most important factor for their post-secondary enrollment decision. And 59% of prospective students worry about how to pay for a post-secondary education. And as Florida continues to grow, like most of the Southeast, our student body is becoming more and more diverse, more non-traditional in many respects. We have 40.7% of our public students are lower income. 63% live off campus and are more directly impacted by those market rates for housing. 48% of our students are attending post-secondary education part-time, and a growing number of our students are in the 25 to 64%. Nearly 1/5 or 18% of our students are adults attending post-secondary education. If we go to the next slide, I'll refer to some of the key recommendations. And one of those, of course, is to adopt universal FAFSA in Florida and to increase FAFSA completion. Florida students left an estimated $350 million in Pell Grants on the table in the most recent FAFSA year. We also need to improve awareness of and access to public assistance programs for eligible students. 3/5 of our students are housing or food challenged. And so awareness of safety net programs such as SNAP and WIC and TANF is a big part of improving the affordability experience for our students. We also need to take a look at how we can expand the Florida Student Assistance Grant, or FSAG, to strengthen need-based aid for Florida students. We had roughly 40% of eligible students in Florida that qualified for FSAG. They did not receive any FSAG dollars due to a lack of funding. And inflation has taken a bite into the statutory limits of the FSAG allotment on a per student basis. And finally, 73% of our students have experienced some sort of financial difficulty while attending post-secondary education, and 57% would struggle to come up with a $500 emergency expense. So we need to encourage development and local partnerships for enhanced emergency student aid. And that is so important. Number one, I've underlined it. Number two, we've arranged this entire webinar around emergency aid. So I'm going to turn it over in a second here to Will and Brene from HCM Strategists, who have forgotten more about emergency aid than I have ever learned. And so let me just provide a brief introduction of our experts from HCM. Will is, as Kim said, the managing director of strategic finance and student success. He works to support post-secondary finance and affordability strategies to provide equitable opportunity and improve student outcomes through data analysis and strategic planning to align student success efforts with state, federal, and workforce policies. Will actually began working in education at Philadelphia Futures, where he supported a cohort of 20 high school students through academic programming and the college application process to become the first in their families to attend college. So he's a true college access professional and first gen guy at heart. Since then, he has developed and executed policies and budgets for federal education programs at DOE, Senate Health, Education, Labor, and Pensions Committee, and was most recently at the Office of Management and Budget, where he covered issues related to college affordability and quality, Pell Grants, and free community college. Will received a Master's of Public Policy from Duke University and his bachelor's degree from Haverford College. He's joined by his colleague, Brene Smith, who is Associate Director at HCM Strategists. She provides support across client projects through research and analysis. Having joined HCM in 2023, she works on issues and projects ranging from state budget proposals to strategies for enrollment, retention, and completion outcomes for low-income students, which fulfills her interests in working to advance policies to improve access to higher education and student outcomes, especially for students who have been historically underserved. She began her career in student affairs at her alma mater, the University of Michigan, where she enjoyed supporting and working directly with students. She earned her bachelor's degree in psychology from UM and a master's degree in education from the University of Pennsylvania. So with that, Will and Brene, take it away.
Thanks so much, Dave. Really appreciate it. Really glad to be here with everybody. I'm just going to sort of get us started a little bit. But so yeah, we're with HCM Strategists. It's a national education and career connected learning consulting firm. We're located all over the country, and we work with states, philanthropy systems, institutions, and student advocacy organizations in order to transform educational opportunities for historically underserved communities. So we really enjoyed the chance to work on this project where in partnership with the Gates Foundation and with FCAN, we dug into a landscape analysis of what emergency aid is offered in Florida institutions and also best practices in running emergency aid programs and lessons that we can learn from other states around the country that have their own programs as well. So with that, I'm going to let Brene lead us through a bunch of the first bit of content.
Thank you, Will, for kicking us off. It's great to be with you all and engage in this important conversation today. So we'll start by defining what we mean when we refer to emergency aid. So our work considers emergency aid as grants or loans to students for unexpected costs for expenses related to housing, food, medical expenses, transportation, which may arise in the normal course of life for a student's college career. And this is separate from things like disaster relief. And these grants typically range from $500 to $1,000 to cover these one-time emergencies that help to cover unexpected costs related to life necessities. And by federal definition, emergency financial assistance refers to emergency aid grants that they must cover unexpected expenses related to a student's cost of attendance, but not already included in cost of attendance as traditional financial aid would. And why emergency aid? So as FCAN noted in their Real Cost of College in Florida brief and reported on today, financially, college is out of reach for many students, including in Florida. Nationally, 56% of college students say they would struggle to cover $500 in unexpected costs. And over 3/4 of Florida students who left college, stopped out before completing their degree, said it was due to financial reasons. So emergency aid grants are an increasingly common strategy that states and colleges are using not only to support students in financial need, but also to support student retention and completion. So studies have found that emergency aid recipients have much higher retention and completion rates. And the strongest evidence indicates that these grants are most effective when paired with wraparound or comprehensive supports. And completion is crucial to the return on investment, not only for students, but also for states. So it can cut in half the likelihood of missing student loan payments or receiving public assistance. So it does have an ROI for states as well, and not just the student. And what we've gathered from literature and interviews with institutions in Florida, as well as other Florida stakeholders specifically, is that there is an advantage of emergency aid over need-based aid in Florida. One, these are just-in-time funds, so these funds are timely in typically urgent situations where costs are unexpected. Two, these emergency aid grants are available to all, so all students can find themselves in a bind where they need additional funds. So this can cover those expenses for them. And then three, they tie into holistic supports, which is a best practice that we've identified through the literature and also found that many institutions with emergency aid programs in Florida already do. And now I'll just cover the specifics on the research that we conducted. So we conducted a literature review on the existing research and the impacts of emergency aid, as well as uncovering a set of best practices. We also did an assessment of state programs with existing emergency aid programs based on interviews with representatives close to the programs in the states, including North Carolina, who we'll hear from later in this conversation, as well as Virginia, Tennessee, Texas, Washington, Minnesota, and Michigan. And then we also did a scan of Florida institutions that already offer emergency aid programs, cross-referencing that list with FCAN's existing list to identify these programs. And then lastly, we conducted interviews with a subset of institutions in Florida for a total of 8 institutions in Florida, as well as Florida entities and other stakeholders. And now I'll just cover some of the best practices that we uncovered from the literature review, as well as our interviews. So this list is not meant to be exhaustive, and undoubtedly these practices will look different across programs and institutions based on a school's context, but these are the core areas that we found as best practices. So one, the application process. So clear criteria are very important without any extraneous requirements like essays, and applications should be made easily accessible, usually through electronic formats. And then it's also important to have a designated point of contact for students to go to help navigate the application process. And then second is around timing. So with these emergencies, timing is very crucial. Clear processes and protocol for evaluating the applications make for quick and efficient turnaround times, and having goals set for these turnaround times really helps staff to stay on track to hit these goals and process applications in a timely manner. Thirdly, around the decision-making process, to help with timing, the decision-making process must be well-defined. So first, by ensuring emergency is clearly defined so that all staff are able to make appropriate and quick decisions. And this can be done by providing rubrics and guidelines to decision makers, which is important in defining the process and making it efficient, and also making sure that they have the adequate amount of training to adhere to these guidelines. And we also found that cross-departmental collaboration is important. We want to note that institutions should also still be mindful of quick turnaround times and the timeliness of their application processing, but the collaboration across departments really does promote emergency aid programs as a campus-wide initiative and creates an expectation of shared ownership. So it's important for high collaboration with defined roles across each of the departments. And as we mentioned earlier, comprehensive support is crucial to the success of emergency aid programs. So ongoing communication during and after the process ensures that students are connected to resources that support long-term financial stability far beyond when they actually receive the emergency aid grant. And then providing those wraparound supports in addition to the emergency aid really is most effective in supporting student success. And as far as outreach and messaging and communication, it's important for institutions to make sure that the campuses are well aware of the emergency aid that's available, including faculty, staff, and students, and that this information is widely available. And in its dissemination efforts, it's important that the messaging is clear and supports a culture of care as students find themselves in difficult financial situations. And then lastly, data at HCM, we are very data-driven and love data. This is a best practice that we found. Having a robust data collection system is key to ensuring proper tracking of the emergency aid program, as well as a way to analyze program impact and student outcomes. And I'll turn it over to Will to dive into potential growth for Florida emergency aid programs.
Great. So yeah, Brene alluded to, we did a little bit of quantitative and qualitative analysis of Florida's emergency aid programs at the institutional level. So we found emergency aid programs in 2/3 of state universities, but less than half of state colleges. We also then looked at kind of how access to these programs varied along characteristics like geography, demographics, size of the institution, cost of the institution, to see if there was a difference between the schools that offered these programs or those that didn't. And what was pretty interesting was that we didn't find much variation at all. You know, these programs sort of are at the institutions in a sort of representative way of institutions across the state themselves. The one maybe difference is that institutions that offer these programs tend to be a little bit larger than those that don't, which actually means that more than 2/3 of students at state universities have access to these programs, and more than half of students at state colleges have access to these programs. So that's good, but as we note in that header, there is sort of room for growth. There's, you know, many students that don't have access to these. And in our qualitative interviews with institutions, we also found that there's variation in the design and implementation, which indicated some room for improvement in the implementation of the programs as well. So, you know, it's good to have institutions put their own kind of stamp and design on the programs to make sure they work for their environment, their institutional culture, their students. But we did identify a few things that stood out to us. So one was around turnaround times. You know, we did see some institutions that were very successful at getting funds into students' hands within 48 to 72 hours. But there definitely were some that had, you know, a weeks-long wait period as well. Second was around outreach and communication. And, you know, we heard from some institutions that it was not a very methodical process, or that there wasn't a big campaign in order to make sure that the program was widely known among faculty, staff, and students. But really, in some cases, it was almost a word of mouth operation. And some of this honestly came down to the funding available. A lot of the institutions found that, you know, they didn't have enough funds to go around to meet all of the demand for emergency aid. And so advertising it widely would have sort of just exacerbated the shortfall in some ways. So then finally on data collection, you know, this is a really important aspect, as Brene mentioned. Some institutions did track student outcomes from those who received their grants. Others did not. Just sort of a pretty common data collection effort was, you know, what was the grant, what was the emergency, who's the student. Some then looked at how those students performed in terms of retention and completion. But we did not see many institutions that looked at applicants who then did not get the grant. So it was hard to track the level of demand, which is something that certainly would be useful for indicating the need for larger investments in these types of programs. So we can go on to the next slide. So Brianna mentioned we looked at emergency aid programs in other states. We looked at Virginia, North Carolina, Washington, Minnesota, Tennessee, and a short-term program in Texas, and pulled out a number of lessons that other states can pick up from in terms of starting and designing an emergency aid program. So one is just to get started somewhere. A lot of these programs in other states started pretty small and grew over time, both in their level of funding and in kind of their eligibility requirements, becoming more expansive and allowing more students to access them. There definitely was a balance of this issue of flexibility versus centralization. So flexibility is great to allow institutions to kind of continue to run their programs the way that they are now, without having to change a lot of systems or operations. But centralization in some of the states we talked to definitely helped with that data collection and making sure that some of those practices are best practices. Another thing we saw was some of the programs had really targeted focuses on particular populations. And while emergency aid best practice would say all students, should be able to access the program, due to either funding constraints or political constraints or whatever it might be, certain states targeted their programs to specific student populations, to those who are closer to completion, to parenting students, to those enrolled in specific programs in order to sort of help build support for the program. We also saw public-private partnerships, so private dollars sort of coming alongside state dollars in a couple of states in order to get these programs started. And coalition building being a really big part of the effort, particularly in Washington and Minnesota. But sort of student basic needs coalitions had emergency aid as one part of a broader agenda that helped to push this through the state legislature. And so thinking about kind of for another state, a state like Florida or any other state that may be thinking about how to expand access to these programs, we sort of, our work helped us think about that effort in a short, medium, and long term, right? So in the short term, really looking at how to improve the implementation of programs at institutions that currently have them, and also to help kind of build the case a little bit, start to collect the data in order to be able to show what the demand is, what the impact is. And so, I think a big first step is to just start to create an identity around the institutions that have these programs, to know that they're all out there, that they are part of the same effort, and build that coalition and start to be able to collect data to show their impact. In the medium term, a little bit more of kind of building the case, and then also finding ways that at the system level or the state level, you can start to build in a little bit more support for the institutional level programs. So some states conducted a basic needs survey statewide to help demonstrate the financial needs of students. Some states, had sort of a pilot program in a couple institutions. States and systems can also help sort of amplify outreach and communications about the programs at institutions to help with that, spreading the word and making sure all students are aware these exist. And then, we've talked about the sort of basic needs support and the wraparound services, and I think the state and system can play a role in improving access to those public benefits by partnering with institutions and making sure students who get the emergency aid can also be aware of or sign up for the public benefits that they're eligible for as well. And then on the long term, for states that want to move towards a state investment, like the 6 states that currently have funding at the state level for these, one approach is to make emergency aid an allowable use of an existing program, an existing financial aid program. So in Virginia, there's sort of a set aside or a carve out. An institution can use a portion of its funding for need-based aid to go towards emergency aid grants. Funding navigators on college campuses would be a sort of supplemental support to emergency aid, so that students who receive these grants have that kind of wraparound navigation support that leads to longer completion success. And then finally, if there is a new state-funded program, it may often be tailored to a state's priorities, just as a way, again, of recognizing that while the best practice is for it to be universal, it may help to start with a targeted effort, again, focused on a particular student population, or those who are closer to completion, as the program in North Carolina does. And that sort of wraps up our research. And I mentioned North Carolina at the end there is the perfect segue into our into our good friends from North Carolina. I'm looking forward to hearing their conversation.
Thank you, Will. Thank you, Brene. And yeah, it was sort of like designed that way. So thank you very much. I really appreciate it. I know many of you, have some questions, and I've already seen one in the chat box. We'll answer those in real time, and then also at the end. So go ahead and make sure any questions for Will and Brene. We're entering those into the Q&A box. I want to go ahead and introduce our friends from the Tar Heel State, Dr. Tori Reynolds and President James J.W. Kelly. Dr. Reynolds is Associate Vice President of Student Services. She's with the North Carolina Community College System. She joined them last summer. She's got more than 20 years experience in higher education, and most recently as an AVP of Student Success at Forsyth Technical Community College in Winston-Salem. With the college system, she's responsible for leading efforts to ensure statewide opportunities exist for students to enter and succeed in high growth and evolving employment pipelines. She leads the Student Services Unit to promote a smooth experience for learners across the community college system as they navigate the process of lifelong upskilling and reskilling. She has a Bachelor of Arts from the University of Pennsylvania and a Master of Education from Kutztown State, and also in Pennsylvania. And in 2015, she earned her doctorate in educational studies from UNC Greensboro. President James J.W. Kelly, he's president of McDowell Technical Community College in Marion, North Carolina. He assumed the presidency of McDowell Tech in 2024 after more than 2 decades of service as an educator and administrator across the North Carolina Community College system, and also member institutions in Asheboro, Fayetteville, and, as I mentioned, now Marion. His career in education administration is marked by a series of progressive leadership roles, contributing his rich expertise in the community college system, showcasing his talent for strategic planning, student services, innovation, and community engagement, all the while affirming his commitment to enhancing educational opportunities and fostering student success. He's an Army veteran, having served our country in Operation Just Cause and Operation Desert Shield, Desert Storm. He holds a EDD in the management of programs for children, youth, and families from Nova Southeastern University, along with a master's in counseling from Cincinnati Christian University and a bachelor's in Bible from Johnson University. Dr. Reynolds, President Kelly, thank you so much for being here. We've got a little bit of a fireside chat set up, arranged. Your paths have crossed. Dr. Reynolds, you've been at institutions and now you're with the system. President Kelly, you've been at the system and now you're at an institution. So I'm sure you'll be able to navigate these questions as we go along. I think first off is I always like to begin with the origin story. So talk to us about the data that you saw in your institutions and across the system that suggested a new approach to emergency-based aid was needed, and what eventually led to the establishment of North Carolina's Finish Line Grants program in 2018.
Well, if that was a dissertation thesis, I'd say you need to focus a little more. That's a pretty broad question, but thank you, Dave. And Tori and I chatted a little bit ahead of time and thought, because as you mentioned, we've kind of crossed paths. So she's currently sitting in the chair I sat in last summer. And when we began this Finish Line Grants program, and she was at a college. So even though we've kind of talked about, Tori, how we're answering these questions, you would have a unique perspective in the birth of this program from a college perspective when I was sitting at the system office. And now our roles have changed a little bit. A little bit about a context, I think, helps answer this question. And that is, we're 58 community colleges across the state of North Carolina, and the governance structure is that each of the 58 community colleges have their own board of trustees. So the presidents report to a local board of trustees. We do not report to a system president like our university partners in University of North Carolina system. So that's important as we get to other questions about why centralized, decentralized, because part of that governance structure, I think, impacts that decision-making and those politics. So I wanted to mention that. The other thing I want to mention real quickly is the HCM best practices and some of those comments. I mean, those are spot on, especially as that best practice slide. I would say that each of those are definitely a best practice, but then there are also probably each of those categories are areas where we've struggled over the years when it comes to the implementation of the Finish Line Grant. And just to help a little bit, I threw in the chat the current website for the Finish Line Grants program that's at the system office. That might be a nice little reference for people in the future to be able to go and see kind of what's going on there. It has some of the history that we're going to talk about. So I think each of us have run into a situation where we've heard the story of the student who had the flat tire and they couldn't get the tire fixed. And so then they can't go to school. And then you find out that they're actually giving rides to 3 buddies. And now you actually lost 4 students, not just 1 student. And that's a common story, I think, not just in North Carolina, but probably in Florida as well. So the birth of this program was that those kind of stories made their way not only to the system office, but also to the governor's office. And Governor Roy Cooper said, we've got to do something. So a parallel research project began of collecting those qualitative and quantitative type of research to figure out what's going on at the local level, because we knew nothing was going on at the state level. We surveyed the colleges. Almost all the colleges said they had some form of emergency grants, and everybody said they didn't have enough. And they needed more. Everybody had different eligibility criteria. Everybody had different interpretations and definitions of what an emergency was and what was eligible expenses. It was all over the place. So the conversation led from the system office and the governor's office to bring in the Department of Commerce. And Department of Commerce said, well, we have some Title II workforce money. What if we brought in some of that workforce money and tried to supplement it to the rest of the colleges? Problem arose immediately, right? So Title II money has strings. WIOA money has strings to it. So how do you standardize that across the state, but yet still give the colleges flexibility? We did the best we could to try to manage all of that at the beginning. But when you're talking about meeting the WIOA requirements for eligibility for those funds, it got a little sticky pretty fast. But the data we saw was basically, to answer your question, Dave, was really is colleges were reporting and the stories were students were having to drop out because of these life expenses and unexpected life expenses that would come up. So data was rare to really know what was going to be successful. So when we get back to the reporting, and I think there's another question about that, is we tended and decided, since like I think Will said earlier, focus on the small to begin with and then see where you can go after that. So the focus on at the begin was is can we just keep JW in school this semester? So we didn't try to look at retention, completion rates, or anything like that to begin with. We just wanted to know how many students raise their hand and say they need help, and how many of them can we keep in class that semester. And so we just tried to start with that small sense of data because that's what was reporting back to us. The reason we ended up being targeted was because we thought that we were afraid we'd run out of money. was the bottom line. So we said, what if we say people that were at least, I think we started with 75% completed of their coursework. So they really basically only need one more semester. So they need one more semester. If we can keep them in classes that one semester, then they're likely to complete their credential. So we had very little data. Most of it was stories. And that's kind of how things kicked off. Tori, what did it look like from a college perspective? That's what it looked like from the system office.
Yes, at the time I had been working in academics on the academic side of the house, and we were replete with stories of students going to faculty saying, we had attendance requirements and they missed so many days, and they say it's because the bus was late, or my car broke down, or I needed to take a sick child to the doctor and we didn't have any money to supply for gas. And so it was very clear that there was a gap in what we could provide through traditional financial aid venues and what students needed to be able to persist just in that moment. And so as JW was speaking, the best practices were spot on. It's just these little lump sum amounts that can derail someone's path, that can derail their life. And so so we started seeing flyers around campus and in elevators and on bulletin boards about this Finish Line grant. And while we didn't know very much about it, it was something that when you heard a student in distress, it was something that we could at least connect them with another human being that may have more information than what we did as faculty members, as staff and administrators. And so it began to develop relationships with students. Instead of being, oh man, I really wish I could help this student, you now had someone to refer them to. And I did not necessarily know how the loop was closed. However, I do know that in times when students were not eligible for Finish Line grants, maybe they didn't hit the threshold of completion at that moment, they were at least connected to someone who knew about other pots of money or other resources or in the community that they could connect them with to help these students mitigate that particular pitfall that they were coming into contact with at that moment. So it really changed the way I think faculty and staff could make referrals and began a huge movement towards holistic student support, helping us to understand that our students are not just always the traditional students who can call mom and dad and be able to get support. Or if my car broke down, I'll call my cousin and ask for a ride, but not everybody has those networks. And so we began to focus on providing networks of support and connection for students who are running into these problems because of grants like the Finish Line grant.
Yeah, that's a lot of connections between the story, as you put it, and the research that Will and Brene shared earlier. And I want to hear a little bit, this might be the wild card question that we get at the end, in terms of some of the things where you feel like that's the next step for Finish Line grants and for emergency aid in North Carolina, which of those best practices to implement more. But 58 community colleges, we've got 67 district technical centers and we've got 28 great state colleges, but certainly I think on a pound for pound basis, that's many more in North Carolina. Talk to me a little bit about some of the local flavors at the institutional level across the program, and so in other words, how have different institutions within the system made this their own program within the context of the sort of statutory requirements?
When I thought about that question, it took me back to one of the things that Brene mentioned about having a funding navigator. So some of our institutions have robust holistic support systems where this program fit in very well. So I think of two institutions off the top of my head. My former institution, Forsyth Tech, had a program called Forsyth Tech Cares. And it was a system of services where we had a food pantry, you had some social workers who could connect you to existing state aid and local aid or food banks. And when you have someone whose position is focused around making sure that students have access to resources, this just becomes another part of the portfolio of being able to support the students. So it's not necessarily advertised as the Finish Line grant at Forsyth Tech. It's you go to the Forsyth Tech Cares website, you fill out a form indicating what you need, and they use the different resources that they have to be able to bridge the gap for you. So, so if you need food and, or medical care, they may give you food from the pantry, but then give you a little bit of the Finish Line grant to be able to take care of that medical need right then and there. And so, and also at another community college, Nash Community College, they have Blue Love. Their color is blue. And so everything they want to express love throughout their campus, and they go about that as a holistic process. So again, this program just fits very well into the framework that they have created. But some of our colleges that have struggled with being able to use the funds effectively don't have that navigator position there. And that may be a lot of our smaller institutions where the grant is facilitated through financial aid. And so when you're dealing with pots of money like Pell Grants and large scholarships that are hundreds, tens to hundreds of millions of dollars, this grant fund is very small in comparison, and they're not able to dedicate a lot of their resources and time to being able to reach out to students. It's not as, they're not marketers, so it's not as publicized, and students are not able to take advantage of it. So one of the things that I see our role at in the system office in the coming years is being able to produce maybe a toolkit for some of our smaller institutions or our institutions that are as not don't have that navigator type position, so that they can begin to show students front facing what options are available when because if you have to search for it, you're only going to get a certain group of students who have the time and the space to be able to search for this type of funding. And then something to make the application process facilitated quickly for people who are for our staff who are already strapped for time and maybe dealing with larger priorities other than a $500 grant here, $1,000 here. They're thinking about making sure their institution is running with these with Title IV funding. And so that's kind of the role that our system would be able to play moving forward, providing some guidance so that it's very clear to both students and staff what is allowable for our grant funding. For example, we fund childcare, transportation, medical expenses, housing, and in some cases tuition and fees. But beyond that, we don't give any additional guidance. And if you go, if you've ever met people in the business offices at community colleges or at any institution, they want prescription. They want to know that they are whatever money they're giving away is accounted for and very clearly allowable, because if they give away money that doesn't meet the criteria, the institution is on the hook for paying for it. And so we need, as a system office, my team, I think we need to be able to provide a little more guidance and a little more support to each of our institutions who have not been able to maximize the program thus far.
That's terrific. And Dr. Kelly, before you hop in, I just want to mention a few things that Dr. Reynolds brought up, which is, gets back to this has got to be somebody's job, to help shepherd, and whether you call that a navigator or what that is, you got to have somebody who's focused on the students and making sure that those needs are taken. I think that idea of sort of, branding it internally, Blue Cares, is also very helpful. The student-centered approach, when actually this is a little bit of the inside baseball, when Will and Brene asked, FCAN for insight into emergency aid programs, we took a student-centered approach and we said, hey, what if we were a student at one of the institutions and we needed to find out, can somebody help me with something? So we just started on the homepage of every website, and that was our research process. I don't know if it would stand up to academic review, that methodology, but it was, we felt important. And so when you have 58 different institutions in the state of North Carolina and a similar number, it's important to try to have, as you say, some standards, and to make student experience equitable and equal, regardless of where they're at. So I think that toolkit's a great idea. President Kelly, I didn't want to, take away any of your thunder if you wanted to respond to that question as well.
Just very quickly, I think one of the things, I think Tori's spot on. So I'm currently at a smaller institution, and we don't have the personnel capacity to have one person that manages just these kinds of supports. And so, yes, emergency grants live in the financial aid office. So what we've had to do is how can we continually market to the student body, we're here to help, right? Raise your hand. It's a sign of strength to ask for help, not a sign of weakness. And then making sure that everybody on campus knows where you take JW if he needs help. And that's just an ongoing professional development constantly to make sure that everybody is aware that, one, it's okay to ask for help, and two, where do you take them? And then we'll figure out where the funding sources are in order to meet the needs of that one student. The other thing that I think it's really important when you think about the local flavors is that the data and the research at the state level is going to be different than the data and the research at the local level. And so having that local empowerment to do local research to figure out what works there, because just like colleges are different here in the mountains in North Carolina than they are on the coast, people are just different. I'm sure it's the same in Florida. People down in South Florida are different than people in the Panhandle. I mean, it's just different groups. And so you need to be able to do that local research. So for example, very quickly, we were looking at withdrawal rates at one of the institutions I served at, a different one than the one I'm at now. And a group of students had said that they withdrew because of financial reasons. So we were like, well, we need to delve into that. We need more scholarships for this certain population of students, and we need to take care of them because they're all saying the financial reasons. And we were like, well, hold on a minute. Let's check to see what they mean by financial reasons. We did a couple of focus groups, and we found out that what they meant by financial reasons were these young people all got jobs. They needed to take care of their family. And so they were deciding, I'm choosing between college and a job to take care of my family, therefore I'm dropping out of school. So it wasn't that they needed more financial resources necessarily. They needed a more flexible schedule so they could balance their job. So that wouldn't be discovered at the state level. That's something that's discovered at the state level, and that's why that, or at the local level, and that's why that research is so important.
Yeah, no, that's 100%. Before I turn it over to Kim Krupa to facilitate some of the Q&A from the audience, Dr. Kelly and Dr. Reynolds, just sort of one sort of next step question. What would you like to see happen from a system perspective and from an institution perspective over the next 3 to 5 years with the Finish Line Grants program?
Going into the next year, we have been talking with lots of colleges. This past fiscal year, we've only spent about 39% of the money that we have, and we should be far more ahead of that because the things that Finish Line Grants can cover are some of the most intractable issues that our students are facing. Everybody has, anyone who has a child needs emergency childcare at some point. Transportation breaks down. I got a rock hit my windshield when I was driving home the other day. Stuff happens. And so we've been talking with colleges about some of the barriers that they've had about spending the money. And so my goal going into the next fiscal, we have our biennium budget, and our legislature will give us our budget for the next 2 years. But my goal when we get this next funding is to look at how we can make it easier for colleges to spend. What things were legacy from the original requirements that we can now update and maneuver. We have a new governor, we have new legislature, so maybe we're not beholden to the things. What about the lessons learned that we've had? But loosening the reins for a lot of the programming so that students can use it. One of the things we talk about And I guess I'm blowing the question and answer section, but there's no restriction on who can get it. The only restriction we have is our dual enrollment. Our high school students are not eligible for the funds, and our students who are in adult high school but are continuing education, so our non-credit students are eligible. Our curriculum students are eligible for the money. Doesn't matter your FAFSA status. Everybody's going to need need a hand up at some point in time, and there's no way to. Some people feel like it's an abuse of the system to say, well, everybody can use it. Well, the richest person in the world may need help at one time, and when they've received help, they may come back and give us donations in terms of being an alumni. And so I like that this program is so open and willing, and we want to give the colleges the flexibility. They're the ones with the students. They're seeing the situations. They can help the students navigate, and we as a state agency don't need to be critiquing the way that it's happening. Yes, we want things to be ethical and legal, and beyond that, we should have liberty in being able to disperse funds.
That's great. President Kelly, anything to add?
I'll just say amen.
Excellent.
Yeah.
All right. Well, Kim, why don't you go ahead and see what questions our audience have?
Absolutely. Our first one is on award displacement, and we're wondering if any of our colleagues on the call can share how your system or your research addresses potential award displacement when providing emergency aid. And have you found effective ways to structure these supports to maybe avoid displacement issues? On the theme of complex issues that require careful coordination with financial aid offices.
I believe our business office would beat me up, but I'm not exactly sure how how we code this money in our system, but it's not dependent upon someone's need base. And so being able to have the money is not like, if you have an SIA of a high SIA or a low SIA, students are not required to demonstrate financial need in the traditional sense. So we don't necessarily take into the cost of attendance when we're thinking about it. It's just that particular need, we are able to support it. Some institutions we have in our community college system pay directly to the vendor, which circumvents it being paid to the student, and then the student doesn't have to report it. So there's a lot of flexibility in how the money can be distributed to students, so it doesn't cause them to have financial burdens such as reporting it as income or as additional grant aid.
I would, the federal guidance on the emergency financial assistance, as Brene mentioned at the outset, is that it is not counted as other financial assistance, which would then require adjusting the student's financial aid package. But to go much beyond what I just said, I would suggest talking to somebody at Federal Student Aid.
Perhaps similarly for the cost of attendance question, especially you, Will and Brene, looking at the research that you did with implementation, did you find examples of how colleges are adjusting cost of attendance calculations to maybe better reflect our current housing costs and other maybe inflation impacts?
I don't think this did not come up in any of our conversations with institutions. So I'm a little bit, again, reluctant to speak too much to this. But I'm curious if any of the other panelists or any of the other colleges have seen any work on this.
Any takers?
Not seeing any, I'm sorry.
Yeah. Huge issue. Maybe the systems haven't caught up to it, the gap between standard cost of attendance and actual living expenses, as I'm sure all of us have that lived experience. And looking at the clock, I believe that's our last question. Oh, maybe we do have one more. Maybe we could squeeze in this Esther Funds Foundation question. How can organizations like ours best partner with schools or state programs to expand emergency aid and support college completion?
I'll
Thank you for
jump
that.
onto that one very quickly. Is at least in North Carolina, I don't know if Florida is the same, working directly, even though it may be more burdensome for the foundation, but working directly with the college foundations That eliminates going through the state system, which then has a lot of the state rules that then get applied to it. So if you work foundation to foundation, a lot of times that gives the college more flexibility to serve their students.
I just wanted to add that I think part of what we recommended was this coalition building effort, right? And so creating partnerships and just relationships and making sure that people know that you're out there and wanting to be a part of this effort will go a long way in, I think, supporting the work both either at that institution and across the state.
Wonderful. Thank you all for sharing this important work. And from the research presented today and these insights, we've definitely seen that partnerships can help expand so much and extend our impact wide and deep. So thank you. Dave, you want to wrap us up?
Well, I just echo all of the thanks. Thank you to our friends at HCM Strategists. Thank you, President Kelly. Thank you, Dr. Reynolds. May everybody's favorite baseball team win today, unless we have folks that are cheering for opposite teams, and let's hope for a 27-inning tie. Thank you so much. As Kim mentioned, this webinar will be distributed to all attendees. It'll be posted on our website. Don't forget to register for the summit. And thank you all very much from the Florida College Access Network. Bye.